Negligent and abusive nursing care. In 1999, more nursing home residents died as a result of negligence and abuse than the number of U.S. soldiers that have been killed in Iraq, until this date. Clients are not properly cared for because of nursing staff in some situations. The latest data from the National Center on Health Statistics, a national compilation of more than 500,000 nursing home deaths, for 1999, lists starvation, dehydration or bedsores as the cause of death on 4,138 death certificates. Is the quality of care your loved one receiving important? How devastating would the loss of someone special be to you if you learned their death was due to negligent homicide? Would you be enraged if incident reports of abuse were dismissed or thrown away? This quiet pandemic is rarely detected by government inspectors or investigated by law enforcement. Many doctors have falsified documents by stating incorrect causes of death on the deceased victims' death certificates. Almost all of these deaths are preventable. More of these deaths can be prevented if all states require detailed background checks before an individual becomes a caregiver to check for abusive behavior. Patients are dying because they are deprived of water, ADL care, or are physically beaten. Many nursing home documents are falsified. Dr. John Morley, at St. Louis University stated, "I see a lot of death certificates signed with myocardial infarction, which means, I don't have a clue because I wasn't there when the person died. Far too many death certificates list the cause as cardiac arrest, but that is, usually, a wastebasket diagnosis, because everyone's heart stops beating when they die. The actual causes of death are not stated truthfully to cover up these deaths. The detection of many of these deaths is dropped by state inspectors that don't correct the problems. Incident reports are pushed aside as if they are not important. Many nursing home deaths aside from those people who refuse the basic care are still too high. Many clients who go into a nursing home for simple recovery do not come out. Some patients deteriorate within 2 to 4 weeks from their admission date, while living at the nursing residence. Many patients that die are not given proper amounts of food, water or timely medical treatment. If they can't take in nourishment on their own, they may starve. The victim begins to lose weight. For the patient that needs total care, and has to be turned every 1 to 2 hours to avoid skin breakdown, untreated bedsores cause a life-threatening toxic poisoning of the body called sepsis. The reed, bird-like wounds appear. If left untreated, this tissue then begins to decay from lack of blood circulation. If the nursing facility has a skeleton crew, a patient may not get turned and changed on a timely schedule. For the patient that is incontinent, this is important as well as hygiene. If their skin breaks down, malnutrition can also reduce the immunity from infections to an almost AIDS-like state and can quickly cause loss of muscle strength. If bacteria growth gets into the bloodstream, toxins build up in the blood and cause dehydration, dementia, kidney failure, infections, and organ failure. When left untreated, any of the three begins an effect of system failures that can kill. Nursing facility abuse can be decreased by setting the highest pre-employment standard as well as increasing the wages of workers who provide direct care. May support staff are the lowest paid workers versus the higher paid professionals. They are also the eyes and ears to the nursing supervisors when problems occur. All states should require higher employment standards to improve patient care.